Is day one of the 7-day strike declared by the National Association of Nurses and Midwives, and the resultant disruption of medical services to patients is visible. At this National Specialist Hospital for the care of eye, nose and throat in Kaduna State, our crew met an almost empty facility. We were told off camera that patients at the emergency ward were discharged due to the absence of medical support for nurses. The national chairman of Federal Health Institutions, Nurses and Midwives accuses the federal government of being insensitive to the plight of Nigerian nurses and midwives.
The unconducive working environment for nurses in Nigeria is unbearable. We have been patient for a very long time. I don't think anybody has ever known nurses going on strike in Nigeria because of the compassionate aspect of our job. We don't want our patients to die. We don't want to subject them to difficulty. But the federal government is not actually taking this into consideration. After this 7 days warning strike, we are going to review the effect of the strike. And if government didn't intervene, we are going to issue government another 21 days ultimatum, which is going to lead to indefinite strike.
The situation is the same in Taraba State, as the state's chairman of the association explains the rationale for their action.
We find ourselves where we are today, and the reason is because of our demands that the federal government, since they have not yet implemented, we try our cool best to make a dialogue with them, but all these things prove abortive.
When medical workers embark on strike, patients are the ones who bear the brunt.
Well, it's been really terrible because what the nurses are meant to do, the doctors are struggling and they can't do it because they're few. And like just today, my veins clotted like 3-4 times because I want to wee, there's nobody to remove it, there's nobody to change the cannula and stuff. So it's been a struggle, and they had to move the cannula, the giving sets to this hand. So I've just been in a lot of pain, no assistance. It's terrible without the nurses. I just hope that this whole thing be sorted.
However, the Minister of Labour in a statement appealed to the striking nurses to embrace dialogue and shelve their action. Part of the statement says the government will continue its meeting with the nurses on Friday to resolve the issues. The nurses are demanding for upward review of professional allowances, creation of the Department of Nursing in the Federal Ministry of Health, the inclusion of nurses in the headship of health policy-making bodies, among several others.